Hey, welcome to the 16th edition of our Certainty in an Uncertain World webinar. Gary is on vacation, and so I'm filling in today, and I'm really glad to be here with you with our panelists. As we get started, Bob's going to be our first one to go. He's got a crystal ball for you today. He's going to tell you exactly where the economy is headed and where the dental profession is and how you can be there before the puck gets there. At the end, I'm going to show you some before and after case studies to try to inspire you and your team. I want to give a plug though. As you see some of the results from offices that are part of this next level practice community, know that you can have this too. If you're not a member already, if you're not part of the community, there is a proactive practice course. It is coming up July 23rd and 24th. It's online, it's for the whole team. It is designed to really get your team ready to begin implementing complete health dentistry. So exciting, 11 a.m. to 5 p.m. both days. And if you're interested just in seeing, what the potential is for your practice, there is a relaunch program that is a great way to just get introduced to this next level practice community. And I encourage you to do it. At PerioProtect, we encourage all of our clients to consider this because it opens up your eyes to what you can do when you focus on the complete health. And I didn't even introduce myself. I'm Tanya Dunlap. I'm with PerioProtect, and I'm really, really glad to be with you today. Bob, we're going to turn it over to you. Bob Affleck from CitiBank. We know PPP money has ended, and what are the options?
Well, let me get my crystal ball out. I just want to show everybody what's happening right now and where we're going. If I can just get this, hold on, everyone. Let me get this up and running. I thought I had this ready to go. Oh, hold on. Sorry, everyone. It's not showing up. I might have to do it without, but I did get my crystal ball out so you can just see it. And I think that's why it's not working, is my crystal ball is a little broken right now. But just want to say, definitely, going through the past couple of months and actually now seeing how everybody's coming out of this this crisis that we've been going through, and obviously still in, but the crisis that we've been going through. I've been very impressed with the doctors that I've been talking to out there. A lot of them have really been very positive and very encouraged by the fact that their practices are coming back strong, and that the patients are starting to really schedule their appointments and they're months out scheduled, which is really nice to hear. So I definitely really appreciate that. So, I wanted to talk about also the current trends that are going on. Obviously, for the past couple of weeks, we've been talking about the different lenders and how lenders obviously have also been slow to move in opening up and lending. What I'm finding is that the lenders now are getting more and more comfortable again with what's going on with the dentist out there. I think that when that's really a good way to determine trends is kind of what's going on with dentistry in general, because once you start to see dentists, starting to get back on their feet, that's what the lenders are looking for as well. And so I think we've really been doing our surveys with the dental offices, and you're going to start to see lenders opening up nationwide, which is a great thing. I definitely, and I've been talking about this for the past couple of weeks, but I've been seeing a lot of this, is obviously mergers and acquisitions. A lot of doctors coming back, especially the older doctors that are a little bit nervous about coming back just because of specific age or anything of something of sorts. They are now in the process of either selling their practices or merging their practices into other practices. And I'm also seeing the acquisitions opening up as well. So a lot of new buyers coming into the market, still feeling confident enough to purchase their practices, which is great. And so, the one thing that I've been helping out with both sides of this, whether it be a merger or an acquisition, I've been helping a lot of these doctors really do analysis on their own practices that they have now, and also the new practices that they're looking at, and what it looks like merging those two together and how the numbers come out. I'll show them their profitability, and show them whether or not it's worth doing it or investing into that next practice. So so I've been doing a lot of that for the past couple of weeks, which has really been great and encouraging. The one thing I have also been getting calls on is unpaid taxes. I think some doctors were putting off doing their taxes. And so unfortunately, some of them were also now surprised with taxes that they owed. So now they have unpaid taxes or having to add on to other unpaid tax debt that they might have. I would say, if this is one thing that you really need to clear up, it would be your taxes for sure, because if at a later date that you ever need to borrow money from a lender, it's really important that you don't have any sort of tax liens on your practice or on yourself, because lenders just will not feel comfortable in lending to that. Unfortunately, the IRS always has first right over everything. So, so if you have any unpaid taxes, let's get that cleaned up. That's also something I've been helping a lot of doctors with as well. I wanted to bring up the EIDL loans for if you're looking at refinancing any type of practice debt that you have, or if you're in the process of refinancing. Some would like to keep that EIDL loan, but the lenders are actually requiring that EIDL loan actually be refinanced, either paid off or refinanced into the new loan. So I know that some doctors were wanting to keep the EIDL loan for possible cash flow needs, if in case something should happen in the near future, and may have to shut down or may slow down, that they wanted some extra cash flow. But if you're looking for extra cash flow, again, it's all about refinancing, getting cash out of your practice to be able to put that on reserve. And again, we're talking about the PPP loans. In regards to the PPP loan, unfortunately, lenders have really stopped taking any applications. And as of right now, that has as of today, actually has come to a stop. But we all know that there is another round coming, but we just have not seen it come on board yet. So we're just kind of waiting for everyone to work it out in Washington. And once they do, then I'll be able to get back to you and let you know what's happening. So I'm going to turn it back over to you. And if you have any questions, Tanya, I'd be more than happy to answer.
Thank you, Bob. Everyone who's here, if you do have questions, make sure you put them in. You can look in the chat session or the Q&A session. Just scroll over the bottom of your bar here and it'll pop up for you. Bob, I have a quick question for you. A couple weeks ago, or maybe more recently, you recommended that people have a certain amount of cash flow ready. How many months worth are you still recommending?
You know what? I'm absolutely recommending at least 6 months of cash flow for their practice. The reason behind that is because, as you saw, we were 3 months without really any cash flow. And now it's going to take us a few months to really get ourselves up and running again. So you want to have that extra reserve on hand as they start to grow and rebuild their practice again.
And I too have been in, I mean, you talked about how fast dentistry has rebounded for many people. I too have been surprised and grateful.
Yes.
And so we hope that these webinars are ways for everybody to get some new ideas and to talk about that, but both new patients and really making your presence known online. We have Sean here from Dr. Genius.
Yep.
All right, thank you, Tanya. Thank you, everyone. I'm going to present a new study by Deloitte and go over some fundamentals too, so we can remember those. But what matters most? Go here real quick. Okay, so site speed, where there's a new study, it's quite profound from Deloitte, and then revisiting some fundamentals. And with practices rebounding, it's really important that we take a look at how we can win. So Deloitte did a study across many different verticals and found that by increasing site speed by 0.1, so a tenth of a second, resulted in some cases, like in the travel industry, a 10% increase in conversion. So imagine for your practice, right? And there's a lot of old websites out there, or even new websites that have a lot of video content or huge images or other things that make it very difficult for a mobile device to render a website. So it makes it very slow and people end up leaving. Now, Dr. Genius, we help with that, but we also want to share that you can take a look at your website, and there's many free tests out there, and you can take a look at where you land, and there's ways to improve it. We'd be happy to help you, but we wanted to share this study just came out a couple days ago. So now we're going to go back to some fundamentals that are a little older, but still very relevant today. So top ranking pages tend to have more backlinks. And what this means are links coming back from other assets online. This does show a robot or an algorithm that you're legitimate enough if you're getting backlinks from other resources. So you may be legitimate enough to show to humans, because again, Google, Bing, and others get questions, and then they need to pair that question with the proper search result. So an example would be like this. You have your website, and then maybe you have a post from Twitter, your Google business profile, Facebook, maybe even another website now referencing or pointing back to your site. This is a very important strategy that you can deploy yourself. We strongly recommend it, publishing content on these platforms and linking them back to your website. I'll go back real quick. This correlation right here shows the people in the top 3 tend to have more backlinks, right? They're 10, 15, 20. Some people have 100 backlinks and more. So it's very important. There's a very strong correlation. So with rebounding and wanting your practice to show up high online, that's a big component. Next, we have a couple screenshots from Google's guidelines. So Google wrote or published 166 pages on guidelines for ranking and web quality and many other subjects. But Google highlighted this. So how pages link to each other is one well-known signal that we use, we as in Google. And then they go on to talk about other signals. So this helps a robot learn and understand that here's an example, dental implants page may have other related topics. So when you think about your websites and your web presence, think about humans. Humans may search for things so many different ways, or they may search for one thing, but as dental professionals, you know they are actually looking for something else. But that's the same thing that Google goes through. And so Google needs to know that your web page has many other links surrounding a topic, so it can be confident that you're an authority. And it's all about trust, authoritativeness, and content and links. So I highlighted right here. Take a look at your web page and see if it has internal links. If it doesn't, ask your webmaster or your provider to do that for you. Here's another example. You can have recent posts, right? So you should be writing blogs. And if you aren't, then you should be delegating it out. And with these blogs being written monthly, you should have recent posts highlighted on the corresponding or relevant service pages. Again, this creates internal links and creates relevance throughout your website of many different topics. So here's another one from Google's guidelines. So we all know this, reviews, but Google is outright saying they consider a large number of positive user reviews as evidence of a positive reputation, which that makes sense. That's logical. So what are you doing for reviews? Do you have a service? Are you asking for them at your front desk? Or how are you generating reviews? And if you just think people will leave you a review just because, that's not a winning strategy. So you need to find a way of how you're going to generate reviews. So an example would be this. This is a client of ours, and they use our tool, but they have 299 reviews. And as we can see, the vast majority are extremely positive. But I do want to highlight that right here, Google's robot is now highlighting what these reviews contain. And there's other categories here, but it's people talking about their toothaches, or this practice was informative, and many other main keywords that will show up that Google will preview to users about the experience and reputation of a practice. And that does help with conversion, people wanting to give you a call. That's what we do. We all look at reviews too. So we know it's important. Dr. Genius can help, but again, this is something you could do on your own too. And it comes down to this, is do it, delegate it, or ditch it. So doing it would be, here's some takeaways for everyone that they can practice on their own. Craft comprehensive content. What that means is like 500 words or more. plus, per piece of content. So you want multiple pieces of content, try to keep it at 500 words or more and focus on one topic. You need to build service pages or have your existing service pages linked to other relevant pages. Publish content consistently to your site and social media and backlink it. You can manually ask for reviews, or maybe there's other tools. Delegating it would be a trade-off for time because it is a lot of time, and you can find a partner like Dr. Genius who could certainly help you, or your current webmaster. These are some takeaways that you can deploy. Ditch it. You don't want to ditch this because this is how your practice is going to end 2020 strong and start 2021 on a good foot. But you definitely want to deploy content. So we present you with this. We're actually going to run a free report. Please go to this URL here that'll also be shared in the chat. We'll analyze your site speed. We'll also analyze your online footprint. So if you see on the right-hand side, there's a little map marker here. You'll tell us 2 or 3 keywords you want us to analyze. We're going to take a look at your area and how does your online footprint look. We're also going to be able to take a look at what your competitors are doing. Do you have a competitor down the road that's just beating you and you don't know why? Let us analyze it. We can do that for you. So just click on the link. You'll fill out the form on the landing page, and then we'll reach out to you and give you a report. Last but not least, we have a huge offer for registrants and attendees for this webinar. So we build our comprehensive websites, and it's a one-time web development fee of $5,000. That's retail. We have a special just for the individuals on this webinar. It's 50% off. So it's a $2,500 one-time web development fee. It gets even better. Your first 2 months with us are free. So this is a huge benefit to make sure we end 2020 right. More importantly, come out of the gates swinging in 2021. And we're $5.99 a month to month. But we wanted to release this offer to everyone that may be watching this webinar. We could really help you out. And that's all that we have for you today. Tanya?
Thank you, Sean. I got a question for you.
Sure.
You said that there were ways to improve speed. What's the most common thing that you guys do to help improve a website speed?
So we will build our clients within our website. So we actually deploy our framework. Some things that we do to make sure that we have a fast site is you have something called AMP. That's an accelerated mobile page. So you'll have a desktop version of a page, and then you'll have a mobile version of a page, which is a much lighter page. You usually will minify images or get rid of images altogether. You'll shrink certain elements. It's because your phone's a processor, so you can only process so much. That's gonna be one of the biggest ones. So our websites will have, it's one website and it will have a desktop full version. And then when it's being experienced on a mobile device, you'll have compressed pages, and that'll be a faster user experience, and it'll lead to higher conversion.
And I know in the past you've talked about this, but I don't remember, so I'm going to ask it. When we send out information to folks, I'm always surprised. It's almost always a 50-50 split. It's usually around 49-51 desktop versus mobile. What do you see? But we at PerioProtect, we are talking to you guys. We're talking to dental professionals. When you send it out to patients, do you know roughly what the split is there?
Well, if we're taking a look, that's a really good question. So depending on if you're like in a rural area or a metro area, I mean, that's going to greatly skew even the demographics. If the demographics are a little older, you'll probably see it's maybe 50-50 desktop and mobile. Traditionally, if we're to do just an average across the US, it's about high 60s to 70% of people are on a mobile device.
Yeah. So you want that speed fast enough for those mobile users to find what they want quite right away.
Absolutely.
All right. Well, thank you so much, Sean. Anybody, if you have
questions, thank you.
Put them in your in the question painter in the chat, and you can also find more information or reach out to Sean with his contact information there. And we're going to turn to Dr. Brian Laskin, ready with teledentistry when we needed it and updating on a regular basis, which is always thrilling to get this. And so today he's going to talk about his therapeutic virtual reality platform, and I want to know what this is. So I'm going to turn it over to you.
Thank you. Yeah, I've got to say, so as the resident dentist on this wonderful panel, I'm learning from everybody, and Sean's presentation was fantastic. Just like every other dentist on this call, I'm sure, I Googled myself to see like what was our rankings. So we had 200 Google reviews, 4.9, so I'm feeling good. Then I look at my keywords, care, technology, efficiency, and I'm feeling really good. And then I saw the word coffee. Coffee is one of my Google terms. So you never know. Like, so you know, we have the little specialty coffee thing up at the front desk. So thanks for that, Sean. That was interesting. I'm going to share my screen here. Never would have thought that coffee would have made the list. But so talking a little bit about teledentistry, and really I want to, for those of you that haven't implemented it yet, really want to talk about how to really improve your team's experience and your patient's experience, because probably like you, we've lost a couple hygienists, frankly, in my office who are switching careers. And so really in the mode still of getting our team's confidence and our patient's confidence, like everybody else is saying, my practice, I think we're booking cleanings in September. So it's we're booked out, but that doesn't mean that, you know, we really have a lot of work to do to get everybody's confidence in the profession as a whole. So make sure to be using a pre-screening form and texting it to patients or emailing it prior to the appointment. We've talked about it on this panel before. We have a couple different versions in OperaDDS, both in the ADA version and the CDC version. They're slightly different, but make sure to get a pre-screening form to patients before they come in the office. Obviously, you don't want your office to be the epicenter of an issue. So making sure that you're getting patients to fill out those forms prior to coming into the office is vitally important. Very easy to do. You know, this is OperaDDS. You can use other systems too, but you can just go to whichever form you want to, then either email or text it to the patient again prior to them coming to your office. And then when you leverage teledentistry, again, we have a little video that you can show patients so that they can take quality images for you. Even if you're going to do a synchronous chat, having a good photo of what's going on is going to be vitally important. So having that at the ready. So you can see here with this little animation that Megan's using the back camera in a mirror and then keeping her tongue out of the way to take a photo. That's going to be a big improvement for patients and for you to be able to get good quality images from people. And then making sure that when you text or email it to patients, even they're in your office, moving it from paperless to touchless. As you can see on this little animation, the patient's information pre-fills and then writes back directly into practice management systems. So these are a list of the forms that we have available, but making sure that you have all your consent forms and intake forms in one place. In red, we have the forms that we've added in response to COVID-19, which is the pre-screening forms, and then also the virtual check-in for people to be able to fill that out when they're at your office in the parking lot, so you don't have to have those touch points. And if you're doing a synchronous teledentistry visit, ours tooth service, again, for those of you that don't know, writes back to practice management systems and actually gets the information. So while you're video chatting with people, you can see the information, you can see what they had at their last visit. It's massively more effective than just like a HIPAA compliant version of Zoom, which is a poor experience for everybody. Then, like Tanya mentioned, I want to talk a little bit about our virtual reality system, which I haven't talked about on these webinars before. And the reason why is I've really been shocked at the uptick in dentists bringing on our virtual reality platform during COVID-19. And I had a meeting with my team yesterday, and really my head of sales was really passionate about this, because he's been talking with dental offices that are talking about the drop in the patient experience, since we have to wear a N95 mask all the time and face shields, and really it was difficult. The patient experience wasn't fantastic, frankly, in most dental practices. You know, at some point when you're getting dental care, it's not been great. People hate going to the dentist oftentimes. And so this is an old slide that we had from when I've researched the top reasons why people hate going to the dentist. And this is them: the cost, lectures, smell, invasiveness, noise, anxiety, pain, and the needle. And what's important about this list, I think, is that cost is at the low end of the list. Really, it's when we're doing clinical care, when there's blood, water, spit flying around the room, all the aerosols that we're trying to manage right now post-COVID-19. It's really the clinical experience that gives people the most anxiety. And so it doesn't matter how nice your office is and how great your systems are, we still need to manage that experience when the patient is having dental work done. And what we're doing with Opera VR, which is a therapeutic virtual reality system that I'll show a couple pieces of, but we're using the immersiveness of virtual reality, which has been it's been researched for over a dozen years to be as effective as nitrous oxide, actually more effective in most cases, where it does true drug-free sedation. So we're actually transporting the patient's awareness outside the dental practice. So while we're working on them, they feel like they're at the beach or scuba diving. And it's really, really simple to use. As you can see here, we have a headset that the patient wears. It's very easy to work around. And then we have a web controller where you log in and you can control what the patient's seeing and what they're viewing. We have some post-operative instructional videos. So like if your hygienist notices that the patient needs to have PerioProtect, you can actually bring on a hygienist video where a hygienist will talk about having scaling rip planing and PerioProtect, and we'll give a comprehensive education to the patient while they're in the chair and while they're having your hygienist actually clean their teeth. So it removes that sort of awkward conversation between hygienist and patient. So we're doing a lot more than just addressing anxiety we're doing education through video too. So you can overlay different video and different audio so that you're in full control of the patient's experience. So fundamentally what we're doing is removing, this is obviously pre-COVID-19. This looks like, it's not appropriate infection control anymore. This patient, the dentist doesn't have a surgical cap. There's no N95 mask. So it's even scarier today. And then we're transporting their awareness to the beach or somewhere else. So it's kind of a novel, new experience. Really, we're the only ones doing this today, but we've been doing it for a few years. I've been in Oprah Winfrey's magazine, on CNN. This has been a really hot topic with patients. And you can see this little guy was at a trade show. What his experience was. It really, for those of you that have used virtual reality, it really does pull you away from where you are, and that's what we're addressing. So it eliminates dental anxiety in the vast majority of cases. It's drug-free sedation, and it's as effective as nitrous oxide. And this is a research study out of Washington that really shows what happens. If the upper functional MRI is a brain scan of somebody with a pain stimulus, not in VR. The lower one is in VR, and the lower brain scan looks just like if somebody's under the influence of morphine, because opioids and VR actually stimulate the parts of the brain that destimulate the pain and anxiety receptors. So you actually get a true sedative effect through immersive video and audio. It's well studied. We've got lots of research studies on our website, and there's more coming out all the time. It's being leveraged now in lots of places, and like Stanford University is a big user of therapeutic virtual reality. We're just applying it directly to the dental setting. And so for more information, that's my email, brian@OperaDDS.com. For teledentistry and pre-screening, go to OperaDDS.com. We also have our virtual reality product there, or if you want to know more information specifically about Opera VR, our virtual reality product, go to digitalnitrous.com.
Thank you, Brian. So I've got several questions for you, because first of all, I find that study fascinating.
Thank you.
The virtual VR is as effective as nitrous, or even if you talk about an opioid, that's just fascinating. So you have videos already loaded into the program. Can you give us an idea of like how many and what they range and interests are?
Yeah, there's a lot of different videos, and we're having more coming out all the time. We have them arranged into groups. So we have a world tour where every quarter we come out with a new place on the planet Earth, right? So I think it's Paris right now, where there's a small tour where there's audio that gives you a tour of Paris, and then there's like Parisian music while you're walking around Paris. So that's less anxiety producing, more entertaining, although it is anxiety reducing, not producing. Yeah. But then we have beaches are a big favorite. We have I'm going to forget. We have an underwater sequence. Cool. We've actually just launched Opera VR Kids, so directed to pediatric offices, where there's like an animated forest where you're going through and the trees are dancing and there's like animated cartoon animals that go by. And it's what's vitally important about the content, in addition to it being therapeutic, is that we have this geared specifically for dental care. So what that means is that we have a 360-degree experience where if you've used virtual reality before, if you look up, you see the sky. If you look down, you see the ground. Well, if you do that in a dental chair, everybody's just gonna be looking at the sky once you lean them back. So we have it geared towards, so the video moves with you in most cases, and your best experience is just to look straight ahead and experience what's going on. So that's a long way of saying we have, I don't know how much content we have. We have a whole lot. It's hours of content on there, split into 6 different what we call adventures, VR adventures. And I think the most popular ones are beaches and the world tours, and then the new kids one.
I think that's awesome. And you did a new tour. If you came in for a perio maintenance visit, you could go to a new place every 3 months.
Yeah, the idea is that you can say to the patient, like, oh, do you want to go to Zimbabwe or go underwater today? And then they can just select what experience they want at that time.
Cool. All right, everybody, if you have questions for Brian, please ask him. Before you go, Brian, before you mute yourself, I just want to let you know, do not underestimate the experience of coffee. I mean, and you play it up, because people like me, we might come for you just for the coffee. Like when I used to fly a lot, if I had a choice between one airline and another, there is one airline that is the best coffee in the sky. I picked that one because I love their coffee. Yeah.
You're not alone.
Yeah.
Based on my Google reviews.
Yeah.
Thanks.
Thank you. All right, everyone. Well, please share your questions or comments there. And I'm going to go ahead and share my screen. This is what we've been talking about over and over again with so many of our fantastic offices, and trying to explain to patients how important their care is, right? And explaining to them that their immune system works like a battery. The more things you have plugged into it, the more demand you place on it, the quicker its power fades. And they really need some help here in order to reduce the burden on their immune system with those infections in your gums, right? We know half of Americans have chronic periodontitis, millions more have gingivitis. So this is our message to patients and to you. And you can do so much for your patients with a little additional home care. So I want to show and just share with you a few cases that came through at our last study club, and this is the PerioProtect study club. So all of these cases involve perio tray delivery. This one comes from Dr. Jim McCrite and hygienist Jamie Rotuno. And these, their case presentations have been recorded, so you can go back and listen to them. But this is the patient on a 15-year recare. You know these folks. They've been a patient of record years and years ago, and they come in. And if you note this chart, this is Florida Probed VoiceWorks. We love their gorgeous charts. This is 100% bleeding on probing, so all the red diamonds you see are bleeding. All the blue vertical lines you see here are recession. Black vertical lines are normal, pocket depths. Red are up to 4 millimeters, and then your candy stripes get deeper than 4. So just to give you some kind of an awareness here, and you see the inflammation. So normally at McCrite Progressive Dentistry, they do salivary diagnostic testing, and of course you would move into scaling also as the therapy advances. The patient declined both the salivary diagnostic testing and also the scaling, and that's a big deal. People who are declining scaling, what other options really do you have? You can see some advanced bone loss here, isolated areas of pretty serious destruction. And then put it all, look at the wisdom teeth here. We got some issues, and that's going to be hard to work around. Lots of calculus buildup. This is a patient who has also been known to chew. Look at the worn dentition. So those of you who are dentists, see, you can just see a lot of issues here. Show you the upper arch. He had undiagnosed sleep apnea. He was also pre-diabetic, and he didn't know about it. So this is when he shows up in April of last year, by the way. And what they did was they delivered trays first. And the reason I'm bringing this case up is because I want to encourage you for your patients in delayed care. We heard Dr. Brian talk about how patients are scheduling their cleanings out in September. They can't get in. You've got patients who missed appointments for weeks or months. They're having trouble getting into your practice to see you also. If they have periodontal disease, if they're in periodontal maintenance, if they have advanced gingivitis, you have diagnosed these conditions, they're perfect for perio trays now before you can get them in, because what you're seeing right here, these results, and you're looking at the bleeding points primarily, this is trays with debridement. And debridement was supragingival debridement with a diode laser being used. And these are the results that you can also see. It's more striking here visually. You don't even need to be a dentist to understand how much improvement is here, right? You can see clear rims of red, and those have been resolved. And this is everyone before scaling, because the patient is refusing it. He was fairly compliant in his use of the tray therapy. Now, trays are used every day. They asked him to start out 3 times a day, and he said he wasn't going to do that. So they compromised at 1 time, but every day. And he did a good job there. You can see this picture is just the full on from a few, we're talking about 2 months of tray therapy plus debridement. And tooth number 3 there, that was pretty infected and is looking much better already. So he's using his trays relatively faithfully at 1 time a day. He comes in to get more gel as he needs it, and his gel usage indicates that he's actually using 1 time a day. And then COVID hits, and he doesn't come in for several months. It just so happened he missed his March appointment. It just so happened he was due in June, and when he came back in June, he had run out of PerioGel. So the PerioGel is the hydrogen peroxide gel that's used. And even without that, he is still looking okay. He's holding steady here. Now he's got some buildup, so this is something that has to be done. But you can see once she being Jamie, she does the periodontal maintenance appointment, he's ready to go back on and use his trays. So even if your patient runs out of gel or doesn't use trays for a little while, they're healthier than they would have been without. This is his June 11th chart. So this is just from a couple of weeks ago. And he managed to maintain a really low bleeding level. When you have somebody who's bleeding at 100%, and then they go down to 68%, and they're able to maintain that for a year, that's pretty exciting when they haven't had scaling, right? You continue to advocate for scaling. We would never say skip scaling. We always want trays to be used in conjunction with scaling. But this is an exciting way. I think the results are exciting because there's not much else you can do for patients between their office visits. And so I want to just celebrate this case and encourage you that it's not the only, they're not the only office. You guys can do this. Michelle Huckey, she's a fabulous dentist in Jacksonville, Florida. She started helping her patients get prescription perio trays by doing a really innovative way of case presentation. She basically doesn't give them a choice. She has divided the cost of a set of perio trays into 4 equal parts, and added that cost onto the quad scale. So now their scaling fee, and everybody in the practice gets it, their scaling fee will include a set of perio trays. So they're paying for them already. She puts them all in trays before she gets into scaling. Now, why would you do that? Why do you want to do that? The best reason to do this is for the patient's own health. If you use tray therapy first with the hydrogen peroxide gel, and sometimes with doxycycline calcium, there are advanced cases that might need the doxycycline calcium as kind of it gives you this wow anti-inflammatory effect. Or if you have bone loss, the doxycycline calcium is a good idea. But when you do this first, you can see in controlled clinical trials reductions in bleeding and inflammation that are significant, both statistically significant and clinically significant. And for Dr. Michelle Huckey, her goal is to get that tissue as healthy as possible before they go in to do their scaling procedure. Because when you do scaling, there's going to be a bunch of bacteria that enter into the bloodstream. And that bacteremia, if you're healthy, your body can handle most of it in about 90 minutes. But if you're not healthy, you have prediabetes, or you have type 2 diabetes, or you have cardiovascular disease, you have high blood pressure, and millions of Americans do. Bacteremia from those procedures is shown now to contribute, for example, to arterial inflammation, or is known to compromise the body's ability to regulate blood sugar. Or there's really new research showing that this kind of infection and inflammation in your gum tissue is linked to the progression of dementia, not a cause of dementia, but the progression of dementia. And these are big things that are concerning people. So she has just made this part of her protocol, and I want to show you the results. The reason she really got into PerioProtect is because she used it on herself. So this is her pre-treatment. She's very, very brave, showing us all her own case here. This is her pre-treatment photo. She had isolated areas that she just could not get under control, specifically between teeth number 14 and 15. So, I mean, she's a dentist. She takes great care of her teeth, and look, this looks gorgeous, but she's concerned about these areas. And so she got a set of trays for herself, and these are her post-treatment results. She uses trays regularly. People ask all the time, what happens if you have anterior restorations? Because the natural teeth will lighten. It takes about 5 weeks to have significantly whiter teeth. But you can see here, she was never able to whiten her teeth past the shade, and now with regular daily use of the tray therapy, she was able to. So this is, for those of you who really want to know, this is a good example of what can happen. If you have a posterior restoration, it's not going to matter. But anterior, you just need to let patients know that this could happen. And we'll put these side by side. And this is visible improvement. And let's look at her chart too. This was a fairly recent chart. What you see here between 14 and 15 is pretty nice. That was a troubled spot she just couldn't take care of. All right, we're gonna go to another patient here. This is her, all right. Going to another patient, we've got some significant bleeding and probably primarily in the posterior. And then this patient is in trays, and this is just adding tray therapy to a maintenance program first, right? So these are her first few cases getting underway and learning how the system works. This was a patient, just constant bleeding. You've got this big reduction from 12 down to 1%, and those were deep in bleeding pockets. Here's another case. This is when you are using trays first. There's a lot of things to say about this case. But what she did was, they wanted an implant. Do you want to put an implant in infected tissue? You don't. You want to get that tissue as healthy as you can before you place the implant if you want your implant to have a better longevity. And so we have, trying to move my image here so I can see, 138 bleeding sites, so 100% bleeding on probing, and some pocket depths that are ranging up to 7 millimeters here. This is a post-treatment image. The tissue is healthier. She was able to place the implant. You can see them side by side. You can see some stippling improvement here, and a dramatic decrease in bleeding and inflammation. This is really where PerioProtect shines. Reducing the bleeding, reducing the inflammation, and that just naturally we can say has a beneficial effect on your immune system. You want to decrease the burden on your immune system. It's always been important, right? But during a pandemic, if you can't avoid the virus, the best thing you can do is be as healthy as possible. That means, you know, for most of us, that means, including myself, dropping a few pounds, eating well, getting more sleep, doing the things you need to do to be healthy, but it also includes your oral health. Oral health takes a new priority here. And patients are hearing this. They have different ears to hear now, and they're understanding that their own lifestyle choices matter, and can help them stay healthier longer. So that particular patient with a 97% reduction in bleeding, we're gonna go pre and post here now so you can just see it. So not a lot of deep pocketing, but a lot of bleeding, significant reductions. And this is just a couple of months. And what this is combining tray therapy with the scaling. In this case, this might even be, yeah, she's gonna have some scaling procedures here, but this would be isolated. 100% reduction in bleeding. You don't always get to zero, but we really get excited when you do. Here's another patient, deeper pockets. We've got an 11 back there that they managed, that, yeah, an 11 back there that really, really did well with. This is not a surgical intervention. This is trays with scaling. It's a 97% reduction in bleeding. And again, this is another feature of Florida Probe VoiceWorks charts. They create these summaries for you with the graphs. And if you have patients that come in long-term, their graphs just continue to go out. And that's exciting because you can really gauge their results better visually. I really, really appreciate the graphs and features that they have here. One more case, you've got some deep pockets. We're talking about 7s as their deepest. Again, 100% bleeding on probing. Tray therapy with scaling. It's a 96% reduction in bleeding. You don't always get to 0, but this is really exciting. And look at the deep in bleeding, 20% down to 1. That's something to celebrate for this patient. So these are not isolated incidences. The research shows that you can really get great results across the board, and not just initially, but to keep them long-term. Patients stay on trays once a day, 10 to 15 minutes. That is usually enough for them. And because it's hydrogen peroxide, you get that whitening effect. It maintains and stays white, and also you're gonna have the freshest breath of your life, even for dental professionals. And for those of you who are just starting out with PerioProtect, I strongly encourage you to get your own set of trays. We offer you team trays, TEAM, just write it across the top of the script or put it in your iTero RX notes. Team trays, we automatically give you a 50% reduction. Not only will it help you explain to patients in your own practice what the trays feel like, how to put the medication in, how long and when you wear them, how to clean them, because you're going to know all this from personal experience, so it just rolls off your tongue. Not only will it do that, but you too, I promise you, you will discern the difference also. In just the first couple of days of using it, your mouth will feel cleaner. It is a discernible difference, and you will have the freshest breath of your life. I like white teeth. I drink a ton of coffee. I have pretty white teeth. However, I like it for the fresh breath, because you don't even wake up with morning breath anymore. I mean, it's a nice thing. If you're interested in VoiceWorks, I just bring this out. There are so many concerns now with hygienists. And Brian, you were saying earlier, some of your hygienists have changed careers. You guys have to retool. If you had a hygiene assistant before, VoiceWorks is one of those things that gives you an ability to work with one person. You don't really need the assistant. You can go to floridaprobe.com, go to that top navigation bar that's green, go to Our Products, click on VoiceWorks, and then, so it's Our Products, and then click on VoiceWorks, and there's a demo. And this demo is eye-opening. What is so awesome about VoiceWorks is the hygienist will talk into the microphone. And it takes a couple of times to really get clear for your voice, but we use it at PerioProtect when we want to chart for people who don't have VoiceWorks charts, because I think it's just so visually appealing. And it recognizes your voice quickly. And you can say 2, 3, 2, and it'll go through. And then you'll say 2, 4, 3, and it'll say danger 4. Or if there's pus, it has this little like siren, and it'll say pus. And it is just, you can't get through the entire chart and not be worried, or at least concerned with some interest in what's going on in your mouth, with all of the, what do I want to say? All of the dangers, the warnings, and the sirens going on. So if you're interested in this product, we love it. If you want to become a PerioProtect provider and you're not yet, providers.perioprotect.com. Our personalized e-training is a great way to go. You get to choose the day and time. It's $299. If you want to use a code to get $50 off, put in Next Level. NEXTLEVEL will take $50 off of your code, and this is all in the chat session. It's just a great way to get your entire team on board, and you really do. Sometimes doctors just schedule it for the hygiene team. That is not going to be as effective, because here's what's happening. Most of the time, it's the assistant that either does the scan or takes the impression. That is the person that's really key. And then it's often the assistant that actually does the delivery. Not always, but often. And so the assistants are a key component to prescription tray therapy and its implementation, but so is your front office team. People ask them so many questions, and it's good if they just understand. And if you're getting ready to implement in your practice, one of the things that's really helpful to do is to set a standard of health. I found this to be really key. Set a standard of health. And I ask doctors, this is a sincere question. How much bleeding is acceptable in your practice? We know you can't always get to 0, but do you take it seriously? And if you do, what are you comfortable with? We recommend 10 bleeding points or more. If you get to 10 bleeding points or more, it's not an isolated infection anymore. If you get to 10 or more, start talking to your patients about periotrays. It's a great way to augment their home care. And if they have periodontal disease, we're talking about chronic infections, inflammation, bone loss already. What your goal is to put that disease into remission. And you want the best way to do this is your in-office procedures complemented at home by the best home care they can have. And so there's a lot of science behind our prescription tray delivery, and I encourage you to ask questions. You can always contact me. We've had several offices who are part of this community here that's meeting on Tuesdays, or you're watching it on the weekends now that we're all back, which is exciting. I'm glad we're all back. Just reach out to us. And that is for the entire panel. Bob and Sean and Brian and Steve Parker, who couldn't be here today, we all encourage you to reach out and talk to us. Take advantage of the Next Level Practice community. Think about that proactive practice course, because you can transform your practice. It just requires a little bit of help from the community and some guidance from Next Level. And I can say that with confidence because I have watched practices for 5 years. I mean, I really did. I sat around for 1.5 years and watched to see if this was real. And they're significant transformations that are all about improving patient health. So you're doing it for the right reason. And if you're interested in knowing what your financial outcome can be, and this is, I mean, you guys are small business owners. This is a real life and death issue for you. Relaunch is a great program. It is an option for you to go in, look at what currently is going on in your practice. So it uses Dental Intel, powered by Dental Intel. It plugs into your EagleSoft, Dentrix, or Open Dental software. And I just did this with a dentist yesterday. It's really eye-opening. It gives you all kinds of stats, and Gary or Jay or one of their colleagues will go through it with you and show you where are your opportunities for growth. What might you do differently, and help you develop a plan. And either you can implement the plan or they'll help you. And Bob, I just want to thank you so much for helping some of the offices too. You've, really trying to help people find their way. I keep saying it's a community here, and I mean that. We are all here to help. So please do reach out to us. All right, we're going to be really respectful of everybody's time and end just a few minutes early. So all the panelists, Bob and Sean and Brian, thank you so much for being with us again today. Gary will be back next week with a special guest, and we look forward to that. Goodbye, everybody.
Bye-bye.
Thank you very
Thanks,
much.
Tanya.